Hi, my name is Jasmine. I'm going to be your student nurse today. How are you?
Good.
Good. All right. I'm washing my hands. Can you identify your name and date of birth, please?
Leah Grabowski, 082101.
Great. All right. Let's match it up to the wristband. Yep, looks good. Leah Grabowski. Date matches. All right. So at this time, I'm going to maintain patient privacy. This is a private room, so I closed the door when I walked in. We are going to be doing a head-to-toe assessment today, Leah, if that's okay with you.
Yep.
All right. And I will maintain patient safety during the assessment at all times. So I'm going to move to this side of the bed. Lift it up a little bit so I don't hurt my back. Okay. So for the general survey, the patient is lying in bed. Are you comfortable, Leah?
Yes.
All right. Patient's comfortable. Patient seems to be happy. Dressed in a hospital gown, which is appropriate for the exam room. They seem to be very relaxed at this time. Are you comfortable in this position?
Yeah.
Okay, great. So Leah, are you in any pain today?
No.
Okay, patient's not in any pain, but if they were, I would say, what does the pain feel like? When did the pain start? Where is the pain? How long has the pain been going on for? How severe is it on a scale 1 to 10, 10 being the worst, 0 being none at all? What makes the pain better or worse? And what other symptoms, if there are any, are associated with the pain? All right. Yeah, so Leah, can you tell me your name, which you already did?
Leah.
Okay, do you know where you are?
At Roberts Wesleyan.
Great. Do you know why you're here?
To get an assessment.
Perfect. And do you know what time it is or what the date?
The 19th.
Okay, great. Perfect. All right, so at this time, we're going to move on to the respiratory system. The work of breathing for this patient is equal, unlabored. She doesn't seem to be in any distress. No axillary muscles or retractions are observed while breathing. So I'm going to go ahead and listen to the front of the patient. Under the gown. Okay, lung sounds are clear in the front lobes of the body. I'm going to ask my coworker to come in and help me roll the patient so I can listen to the back of her. Ready on 3, 1, 2, 3. Bend the knees. All right. Okay, lung sounds in the back of the body are clear. Perfect. Just gonna scoot you over a little bit. Fix the pillow under your head. Okay. Alright, so cover you up a little bit. That takes care of the respiratory system. Everything seems normal. I'm gonna go ahead and listen to the apical pulse for a full minute. Okay, for the apical pulse, I got 77 beats per minute. The heart rate sounds regular. I don't hear any murmurs or abnormal heart sounds at this time. And yeah, so let's move down to the arms. All right. So I've noticed that my patient has IV access on the right arm. The site doesn't look red or swollen or inflamed. The patient doesn't have any pain in this area. I would take some normal saline and flush the line to make sure it's patent, make sure the patient is not in pain, and then cap it with a sterile cap to avoid infection. Skin is warm to touch, pink in color, and it is intact. I don't see any openings or any wounds. All right, I'm going to feel the radial pulses on both sides. Okay, radial pulses are 2+ and regular on both sides. And then we are going to do the cap refill. I gotta lift it up because I can't, it doesn't bend or turn the arms very well. Okay. Okay, cap refill is less than 3 seconds bilaterally. And can you grab my hands, please, Leah? Great. Hand grabs are equal and strong on each side bilaterally. And then I'm going to move on to the bowel assessment. So if you don't mind, Leah, I'm going to lift your gown up. And first I'm just going to look to make sure I don't see anything like protruding or bulging out. The skin looks fine and intact. I am now going to listen. Bowel sounds are present in all 4 quadrants. I'm just going to do some light palpation. Do you have any pain with that, Leah?
No.
Okay, great. All right, let's cover you back up. Put this back up. All right, we are gonna move down to the legs. I'm just looking at the legs to see if I can observe any edema, which I don't see. And then I'm just going to push down to see if there's any pitting edema, which there's no pitting edema and none seen, so no edema on this patient. I'm going to feel for the posterior tibial pulse, which is 2+ and regular, and then I'm going to feel for the dorsal pedial pulse on both feet, which is 2+ and regular also. And then Leah, can you just push down on my hands?
Yep.
And then pull up on my hands. Great. The push-pull assessment is strong and equal on both legs. I think that completes our exam, Leah.
Okay.
Lower the bed in lowest position. Make sure the call bell is within reach. Are you comfortable, Leah, in this position?
Yes.
All right. If you need anything, you can just ring the bell, okay?
Okay.
All right, thank you. Hi, my name is Jasmine. I'm going to do a couple of separate videos. This one is just going to be a video of me drawing up the 2 IM injections and then also the IV push medication. So, yeah. So I'm going to clean my hands. All right. So the first med I have is furosemide 60 milligrams, IV push twice daily. And it is due at 8 a.m., so I chose this one from furosemide 40 milligrams per 4 mLs. I don't know if you can see it. but that's it. So I did the math, and I'm going to be drawing up 6 mLs, because if 40 mLs, or if 40 milligrams is 4 milliliters, then 60 milligrams, which is the dose that was prescribed, would be 2 extra mLs on top of 4 to equal 60. So we're going to do 6 mLs total. So I clean my hands. I am going to take my alcohol pad, and I'm going to scrub the hub for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, and I'm going to let that dry. And while I am letting that dry, I just kind of have a straight needle, and that's what I'm going to draw up the med with. So I'm going to put that onto my syringe. I picked the 10 ml syringe, that way I can draw up 6 mLs, because the other ones are only 3, I think, and they wouldn't have worked. So I'm going to draw back 6 mLs of air, because that's what I'm going to give. And this is dry now. So I'm going to take this off, and I'm going to stick it into here, and I'm going to insert the air, and then flip it and draw back 6 mLs, and make sure there's no air bubbles. And how I do it is I'll flick them after I draw it up to make sure there's no air bubbles. And then I kind of like pull it back a little bit, and then I'll push it up to the 6 ml line. A little bit might come out. That way I know that there's no air bubbles. And I'm going to recap this with the scoop method so I don't poke myself. Alright, and now I'm going to take my label for my furosemide and label the med. It has the initials, the time, the med, how much is in here, which is the 6 mLs, the IV push, which is the route, and the date. And that's the first one. So now I'm going to draw up the, what's the next one? Dilaudid. It's Dilaudid, 1 milligram IM insertion every 3 hours, PRN for pain, from 5 out of 10. And from my report, the patient is in 6 out of 10 pain, and he was last given this at 2:48 in the morning. It's every 3 hours, so it's past 3 hours, and so I'm going to give him this for the pain. So again, scrubbing the hub for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, let that dry. All right, so we're doing 1 milligram, which is equal to 0.5 milliliters, because this is 2 milligrams per 1 ml. So in order to get 1 milligram, it's going to be a half a ml. So we're doing 0.5. And I'm using a 23 gauge for the IM injection, because you can use between 23 and 25 for IM injection. So I'm going to put my needle on there. I'm going to put in the air for 0.5 mLs. Also, this is the 3 ml syringe, because it's a smaller volume that we're going to be given. Now that this is dried, Dilaudid, I'm going to put my needle in, push the air in, and then draw up 0.5 mLs. Get the needle below the liquid. All right. There's an air bubble in there. Okay. Again, I'll flick the bubble out and then I'll draw it back and then push it forward so that way I get all of the air bubbles out. Perfect. All right. My cap, I'm going to, can you see? Scoop it and close it. And 0.5 mLs. It's hard to see because it's kind of coming off, but it's right here. You can't see it. And then I'm going to label JN, allotted, 8 a.m. I am route, the date, and then this is 0.5 mLs. So label it, put that to the side, and then the last one to draw up is the Phenergan for nausea. So that's what we're gonna do next. It is promethazine, 25 milligrams deep IM every 6 hours, PRN for nausea. It's the second line of treatment if the first line doesn't work. As to the order, they gave the Zofran at 4:50 in the morning, and it obviously wasn't effective because the patient in report is still complaining of nausea. So we're gonna do the second line treatment and see if this helps his nausea out. Can't say that word. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, let that dry. I'll put my needle on while I'm waiting. Again, I'm using a 23 gauge for the IM injection. And this is 25 milligrams per 1 ml, and 25 milligrams is ordered, so we're going to give 1 ml. So just put my 1 ml of air in there. Now that this is dried, we're going to poke it in, push the air in, and then draw it back to 1 ml. Okay. Get the air bubbles out, pull back, push forward till you get to 1 ml. It got me in the face. All right, and then cap it, and 1 ml right there. And then I'm going to add my label. JN, 8 a.m., Phenergan, 1 ml, IM route, and then the date. And that's it for drawing up the meds. Also, I just want to add that Jonathan Wright, he did have 2 other injection orders. One was the heparin, 110 units per kilogram, sub-Q 3 times daily, and it's due at 8 a.m., but according to his labs, I circled it, The APTT is at 40, and that is too high, I think, because the recommended range is 25 to 35. So I'm going to hold that because I feel like he's either bleeding or something's going on, and I don't want him to continue to bleed. So I will notify the provider about that and see what he would like to do for that. And then he was ordered for Humalog sub-Q with meals. He gets a baseline of 2 units, and then he's on a sliding scale. His blood sugar is 126 right now. But in report, they said that he is declining breakfast, states he is not very hungry and feeling nauseous. So the order says, again, that you can hold if the patient is NPO or eats less than 50% of his meal. And since he is declining his breakfast, I'm going to hold it because I wouldn't want to give it and then he go into like hypoglycemia, so that would be really bad. So I'm going to hold that and also notify the provider. And then as far as the Lasix, his potassium is okay. It is at 3.7, you can see. So that is okay to give, as well as his blood pressure is 132/76 and his pulse is 70. So there's nothing that, I should be worried about, so that's why I'm going to give that. And lastly, I just realized that I put my initials on the injections. I meant to put the patient's initials, but I figured since I was given it, I would put my initials. But after thinking about it, I just wanted to mention that I should have put his initials. That way it matches up with the patient. So that's my, personal correction that I just wanted to add in there. Sorry about that. All right, thanks. All right, guys, this is my second check. So the order says Dilaudid 1 milligram, IM route, every 3 hours, PRN for pain that is 5 out of 6. So here I have the Dilaudid, and it's 2 milligrams per 1 ml. So I am only giving 1 milligram. So I have already drawn it up. So it's going to be a half a ml. And that is my second check for Jonathan Wright. Date of birth is 6/13/1956. All right, there's that. And then my second med that I'm giving is the Phenergan, which is 25 milligrams deep IM route, every 6 hours, PRN for nausea, second line treatment. So this is the Phenergan, that's 25 milligrams per 1 ml, and that's what's ordered. So we're gonna draw up 1 ml. So that's what is here. And we're gonna give it IM for Jonathan Wright. Date of birth is 6/13/1956. All right, cool. Washing my hands. Patient has pneumonia, so we're going with droplet precaution. So I have everything on and ready to go. All right. Hi, my name is Jasmine. I'm going to be your student nurse today.
Hi.
Hi. Can you identify your name and date of birth, please?
Jonathan Wright, 6/13/1956.
Okay, great, Jonathan. At this time, I have provided privacy. I closed the door for the patient. So, Jonathan, right now, I have your pain medication for your 6 out of 10 abdominal pain, your Dilaudid. And I also have your Phenergan for your complaints of nausea. And I will maintain patient safety throughout this procedure. Like I said already, we already checked the pain, which was 6 out of 10. So that is within the parameters to give it. And the patient is complaining of nausea. This is the second line of treatment to see if it'll be effective. All right, so side note, I'm not giving any sub-Q injections, but if I was to give a sub-Q injection, I would do, the 3 locations I would pick would be the subcutaneous fat tissue right here in the belly. I would either do like the back of the arm right here, or like in the love handle part right here. Just wanted to note that. All right, Mr. Jonathan. So I'm gonna do my third check right now before I give you these. Is that okay?
Yep.
All right, so since you're in pain, let's do your pain shot first. How does that sound?
Okay.
All right, cool. All right, so we have Jonathan Wright, 6/13/1956. Yes, we are giving hydromorphone or Dilaudid 1 milligram IM route every 3 hours, PRN for pain, 5 out of 10. Does that sound correct?
Yes.
And it is equal to 0.5 mLs after we did the math. Since this is only 0.5 mLs, I'm going to go in the deltoid. I can show you that landmark right now. So over here, is the right arm okay?
Yep.
All right, I'm going to find the end of the acromion process, and then I'm going to go 3 fingers down and give the injection right in here. Okay? All right. So we'll do that one first, and then we'll do the third check for the second one. Okay?
Okay.
All right, Jonathan. So let's clean the skin. Go from inside to outside. And we're gonna let it dry. Alrighty. You ready? All right, this
Yes.
is IM route, so I'm going to pull the skin and flatten it, and then I'm going to go at a 90-degree angle, give it, pull it out, safety, and put it in sharps. All right. Next, we have your Phenergan for your nausea, and we have promethazine or Phenergan 25 milligrams deep IM every 6 hours PRN for nausea and second-line treatment. All right, so after we do the math, it comes to 1 ml. And that's what we have here for Jonathan Wright. Date of birth is 6/13/1956. Since this is deep IM, I can't really go in the deltoid. I could go in the vastus lateralis, and that would be, my hand would be on the greater trochanter and then above the knee, and I would give it right in here, like off to the side, and that muscle right there. Or I could do the ventrogluteal area, and can I show it on you? Hope they can see. Hopefully. I'll have my hand on the greater trochanter, and then my front finger would be on the anterior superior iliac spine, and then my third middle finger would be on the iliac crest, and then I would go right in between those 2 fingers. All right. So, since I can't really get to the ventrogluteal site, I'm gonna go in the vastus lateralis right here for you, Jonathan, okay?
Okay.
All right. So, let's get ready for this one. Clean from the inside and go out. And let it dry. All right, you ready?
Yep.
All right. And we're going to flatten the skin and go in at a 90-degree angle and give it, pull it out, safety, and dispose in the sharp. I'm documenting that I gave the Dilaudid and also the promethazine at 8 a.m. and they're also PRNs, so they will not be able to be given until the next available time on the orders. I'm going to go ahead and get your IV medications ready and then come back in and give them to you, okay?
Okay.
All right. Thank you. Hi, I'm Jasmine. This is my second check. So we have Jonathan Wright, the patient. Date of birth is 6/13/1956. So the doctor ordered lactated ringers with dextrose, IV route at 40 milliliters per hour continuous. So that's what we have here. All right. right, and then we have the cefazolin, 2 grams. Ooh, IV piggyback every 8 hours. That's due at 8 a.m. I looked it up in the Davis Drug Guide, and you want to give this over 30 to 60 minutes. So the rate is going to be 100 milliliters per hour, and that's here for the pneumonia. Oh, it's leaking. And then I have the Lasix, which is 60 milligrams IV push, and it is given twice daily, and that is at 8 a.m. And that is here. I drew up 6 mLs because I did the math, and that's what it came out to be. And then I'm gonna give 0.5 mLs every 15 seconds for about 3 minutes. So you wanna give this over 3 minutes. And yeah, I think that's it. Also, I looked up in the Davis Drug Guide, the lactated ringers is compatible with the cefazolin. Yeah. All right, I'm washing my hands. My patient is on droplet precaution because he has pneumonia. I'm gonna bring this tray in with me and then keep it in here because he's on precautions. All right. Hi, my name is Jasmine. I'm gonna be your student nurse today.
Hi.
How are you?
Good, how are you?
Okay, closing the door for some privacy. Can you identify your name and date of birth, please?
Jonathan Wright, 6/13/1956.
Yep, looks good, matches up to me. So, Jonathan, I have 3 meds for you. I have your Lasix for your edema in your legs, and then the doctor ordered some fluids, and then we have your cefazolin, which will help kill the pneumonia, so you'll feel better, okay?
Okay.
And all of them are gonna go in your IV access, okay?
Okay.
And we will keep you safe at all times. Did all my considerations when I did my second check out there. The furosemide levels for the potassium was 3.7, so it's safe to give. And yeah. All right, so I'm gonna start off by checking the IV site. There's no swelling, no redness. Do you have any pain with this, Jonathan?
No.
Okay, all right. I'm gonna start off by cleaning it and flushing it. And clamp it for 15 seconds. Okay. All right, here we go. Okay. Are you having any pain with this, Jonathan?
No.
Okay. All right. Very good. Okay. So we can do your first med that I have here. We'll do your furosemide first. So this is my 3rd check. I have patient Jonathan Wright, 6/13/1956. We are giving furosemide, Lasix, 60 milligrams, which we did the math, is 6 mLs. It is IV push twice daily, and we're going to give 0.5 mLs every 15 seconds. All right. Let me clean this first. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. I'm just gonna step in front so I can see the clock for the 15 seconds. It wasn't supposed to happen, but it's okay. All we go. Okay, another 0.5. Another 0.5. Another 0.5. And 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 another 0.5. Another 0.5. And the last 0.5. Okay. And that is all for that. The document that I gave it. JM, 8 a.m. All right, and let me just flush you one more time. My clothes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Any pain with that?
No.
Okay. I'm gonna leave this while I prepare everything else. Okay, so first we will do your lactated ringers for Jonathan Wright, 6/13/1956. This is lactated ringers and dextrose 5% through IV continuous. And we're doing 40 milliliters per hour. And yeah, I'm gonna open my primary tubing. And, oh, this garbage is here. Sorry. Just gotta take this off. And we're just gonna prime the line. Okay. Okay. Hang this up. We'll swap this out. Okay, this isn't supposed to happen. This is falling out. I'm just gonna clean it one more time. For 15 seconds. This is falling out. Can we pause it so I can get new priming?
Go.
All right, we got some new tubing. I already cleaned the IV and let it dry, this opening part. So I'm gonna put this on. Okay. Okay. Lactated ringers with dextrose. The rate is 40 milliliters an hour. Total volume to be infused is 1,000, but we're gonna do 999. Okay, the clamp is open. So that should be going perfectly. I'm gonna document that I gave that at 8 a.m. Okay, Jonathan, and then lastly, we just gotta do your cefazolin for your infection. So I'm going to back prime this. We have cefazolin, 2 grams IV piggyback every 8 hours for Jonathan Bright, 6/13/1956. The rate is going to be 100 milliliters an hour. And yeah. All right. So, gonna clean this just in case. Again, this is compatible through the Y site. Okay, 15 seconds. Let it back prime. Okay. I'm doing 100. Total volume for the bag is 100. Alright, 100 milliliters per hour. Looks good. Okay, and that is going. Let me document that I gave it at 8 a.m. Alright, Jonathan, that looks like all the medication that I have for you. I'll be back in a little while to check to see if you are all complete with your IV fluids and meds. And if you have any questions or you need me, just ring your call bell, okay?
Okay.
Alright, thank you.